Hi students, this is me, Dr. Aditi Tiwari, and today we will be starting about anorexia nervosa. And yeah, I think this lecture will be helpful to all the medical students as well as the nursing students, and hopeful that you will be able to cover most of the topics and the concepts in your competitive licensing examinations. Okay, so let's move forward. Anorexia nervosa. So in this video, I'll try to cover the concepts like what is anorexia nervosa. It's a very important topic in psychiatry. Okay, so and similarly, what are the different subtypes and how does anorexia nervosa present bodily, physically in the patients, and similarly, uh, a very important concept called refeeding syndrome, and how do we manage the anorexia nervosa. So defining anorexia nervosa. Uh, Anorexia nervosa is a condition in which an individual, especially the adolescent and the girls, much more common in girls, so they always try to maintain a very low body weight. Okay, so they try to push their BMI less than 18.5 kg per meter square. So they have a sense that they have some problem with the body, and so based on that, so they will just try to maintain highly thin body shape. So this is that condition, and when they try to maintain the thin body shape, they often go below 18.5 kg per meter square, and thus this often leads to a wrong bodily presentation, because when the we have to have a normal BMI for normal functioning of the body, but they will often try to push themselves because of their distorted body image so much that they will have too less of a body weight, and so this leads to a condition called anorexia nervosa. This condition is rather called as anorexia nervosa. Uh, so the key diagnostic criteria will be, again, as I said earlier, is like a BMI having less than 18.5 kg per meter square for adults, and intense fear of gaining weight or becoming fat, even when the patient is underweight. Okay. Uh, Now we'd like to go to the next slide, and we'll try to understand now what are the different subtypes of anorexia nervosa. So basically, when the person is uh, trying to maintain a low body weight, so they basically do the two types. Okay, there are two types of anorexia nervosa. One is restricting type, in which the patient doesn't eat at all, does intense fasting, dieting, or let's say they eat very little amount of the food, and they do exercises and just to maintain the thinness, and because of that their BMI goes less than 18.5 kg per meter square. And one thing is that they don't binge eat and they don't do pausing for at least last 3 months. So this is one type, that's a restricting type. And another more common type is binge eating type or pausing type. In this type, the patient, although they are trying to do go with the low body weight, but despite of that, sometimes they happen to binge eat. Okay, they eat snacks and this and that, and they suddenly realize, oh, this is too much. So now they try to puke it out or throw up the food they took, or either they take the laxatives or the diuretics or the enemas, so that the food doesn't stay in the body, and they, as a compensation of binge eating, they try to do these steps like, as I said, vomiting, taking the laxatives, diuretics, or enemas, so that they throw up the food they have eaten. So this is called as binge eating type, or let's say purging type. Okay, and so they must try this pausing or taking laxative, dietetics, enemas in the last 3 months, when they are strictly trying to follow the schedule, or they say the pattern for decreasing their body weight. So now, since they are trying to pause out, so because of that, there is the chances of electrolyte imbalances and hypokalemia. Similarly, the calluses may be developed in this knuckles of their hand, because they are trying to put the fingers inside their mouth and trying to put out. So the calluses may be developed in this knuckles in the hand also. So this is another hint for anorexia nervosa. Now, I'd like to go take you towards the physiological manifestations of anorexia nervosa. Now, since the body weight has gone down, So they have cardiovascular manifestations like bradycardia, decreased heart rate, hypertension, decreased blood pressure, and similarly endocrine manifestations like hypothermia. Now, since they are taking less food, there will be less better soul metabolic rate, so there will be less energy production, and so there will be hypothermia. There will be hypothyroidism. The normal uh, glandular activity in the body goes down. As a result, the thyroid level goes down. Okay, and similarly, amenorrhea. Amenorrhea is anorexia nervosa is much more common in young adults and females. So they often go through the amenorrhea where the menstrual cycle will be paused. Okay, and it's especially because since they are taking less calorie, because of they are taking less calorie, the again the glandular system, the hormonal system goes down. There will be the less production of leptin, GnRH, gonadotropin releasing hormone, less LH, less FSH, and finally less estrogen levels. So when there is less estrogen level, there will be amenorrhea. Similarly, there will be osteoporosis because they're not taking calcium, so they have the fragile bones. Okay, and also because of the decrease in estrogen level in females. So again, that leads to osteoporosis, and this is another important clue in the questions often that the patients will have lanugo. Lanugo is a fine, soft bodily hair, so this can be seen in the person with anorexia nervosa. And as I said earlier, if they are pausing or if they are binge eating or the pausing type of anorexia nervosa, then there will be electrolyte imbalances and hypokalemia, hypophosphatemia, hypomagnesemia can be seen. Okay, now let's come to another important topic here. That's the refeeding syndrome. Now, till now, we understand what is anorexia nervosa, what are the two different types of anorexia nervosa, and what are the clinical manifestations of anorexia nervosa. Now, when the person with anorexia nervosa is started with the nutritional support program, we have to be very cautious and we have to go slow and gradual, okay, and careful monitoring is required. Otherwise, there will be the chances of refeeding syndrome. So, what is the refeeding syndrome? Is that when the patient with anorexia nervosa is given certain carbohydrate in the body, okay, let's say food in the body, now there will be certain calorie increase, right? Certain calorie increase, and there will be carbs in the body. Now when they were not eating the food, the energy production was being shifted to the fat metabolism in the body. Now, as because there is already less carbohydrate, now as soon as they have been initiated with the nutritional support, and if it is not monitored, then in that case, when there is increase in the carbohydrate in the body, that leads to increase in insulin in the body. Okay, when the carbohydrate goes up, the sugar goes up, and the insulin level spikes. Now, when the insulin level spikes, that leads to, because we also always remember that insulin not just controls the sugar, but it has also something to do with the electrolytes. So when the insulin level goes high, the phosphate, the potassium, and the magnesium gets pushed inside the cells in the body. Okay, so there will be the chances of sudden decrease in the phosphate, potassium, and magnesium level, and hence the associated conditions will appear in the body, and this can sometimes be fatal. So this is condition is called as refeeding syndrome, in which because of the changes in electrolyte level, the depletion of electrolyte level in the blood, the patient will develop cardiac arrhythmias and rhabdomyolysis and sometimes even seizure, and this can be fatal. Okay, so we have to go slow, gradual, and strict monitoring is required. So again, while we try to understand how do we manage it, so as I said earlier, the nutritional rehabilitation program going slowly, and uh, personalized feeding program must be initiated. Okay, and also there should be psychotherapy. So psychotherapy can be just family-based treatment or cognitive behavioral therapy, so that the patients can understand what's the problem in the body, what's the problem in the thinking process, and they must really the therapist will try to convince them that okay, you have to think it other ways of ways your body and this will harm your body, and what you have been thinking about your body image, maybe that's not important. Either your physical fitness, your bodily maintenance, that's more important. So this is done by the psychotherapist, and at the same time the psychiatrist, they may also prescribe you with antipsychotics like olanzapine, so that this distorted thinking process can be interfered with, and also managed accordingly. So we can understand that there also be the holistic treatment modalities with psychiatrists, psychologists, dietitian, physician, and everyone involved. Okay, so key takeaways for today's is that uh, one is refeeding syndrome. So whenever we try to manage this person, we have to go slow, go gradual, and must we have the personalized treatment plans. Multidisciplinary care is required, and also we should. It's better we try to recognize such individuals in the family earlier, so that instead of going deep into the severity of the cases, the person can be brought early into the hospital, and early treatment, early counseling can be initiated. Okay, so this much for uh, anorexia nervosa. We'll meet up in the next topic, maybe bulimia nervosa, and accordingly. So I hope this topic covers much of the concept necessary for dealing with your exam questions, and I'm hopeful that you crack much of the questions. Okay, okay. See you in the next video. Bye bye.